Again, we are together with Dr. Underbart, and we're going to look at our interesting topic that we promised you last week. Doctor, good evening.
Good evening.
Welcome to the show once again.
Thank you.
Please say hello to the mothers who are interestingly waiting to listen from you.
Yeah, good evening, viewers, and welcome to this discussion.
Thank you. Thank you so much. Today is Sunday, and we are yet again going to look at menopause. Menopause. Yes. Before I ask a lot, Doctor, let's look at the term menopause. Yes. Why not women pause, men pause, menopause?
So actually the term menopause doesn't refer to men. It refers to, it's two words together. Okay. Meno is menstruation. Pause is to stop. To stop. It doesn't mean the lady stops a man. Okay. It's the period stopping. We thought we are the ones stopping men. No. It's interesting. I didn't think about that before. Really? Yes, but it is meno means part of it is meno, menstruation, pause, stop. So it defines it as well. Okay. Yep. Doctor, what is menopause exactly? What does it mean when I say I'm in my menopause now? Or what? Yeah, so menopause, if a lady says, if a lady is in a menopause, that means she has permanently stopped her periods. Really? Yes. No giving birth anymore? No, she shouldn't really give birth, because for a woman to give birth, she should be able to produce eggs. Yes. Which comes as a result of menstruation. Yeah, so this is the outward expression of what is happening within the reproductive system of the woman. Okay. And precisely, it's an indication that the ovaries have actually stopped functioning. Or at least they are not functioning at a level where they can be able to help the woman get to a pregnancy. And so it brings in many other changes. So back to the ovary. The ovary has two fundamental functions. One is to produce eggs. Okay. I think everybody knows this one. Yes, yes, yes. And the other one is to produce the hormones. Now, these hormones are the ones which make the woman get her periods. So as the ovary's function is programmed to cease at a certain period of time by nature. And so when that function stops, the periods will stop because the hormones go low down and actually almost negligible levels. Now the eggs are not being produced as well because they get exhausted. Okay. Yes, so then you get into menopause. Thank you, doctor. Yes. I was talking to a lady yesterday when she told me she has been seeing this topic. Yes. But she was like, can you kindly find out from doctor? She's 47 years old. Yes. She stopped her periods. Yes. But a few weeks ago, she experienced her periods. What could that be? Yeah, so nature is very kind. Initially, when a lady is going to start seeing her periods, from the beginning, that's called menarche. Okay. That's around 10 to 12 years. Before the girl is not supposed to be having her periods, then around 10 to 12 years, she starts getting her periods. Okay. Now, I told you nature is kind. Yes. When the period starts, it doesn't come like in full swing. It comes in small doses. You find the periods are light, and she sometimes misses her period. True. So nature introduces her to that time of period slowly. Mentors her. Yes, into having periods. True. True. Then she goes into full blast regular periods. And this goes on until she's like 45 years old. Okay. Or 40 to 45 years. Now when it reaches that time, then nature withdraws her experience of period again. Now when that time comes, she's going into menopause. It does not occur abruptly. So nature again takes off the period slowly. So she will get periods, they disappear, and then they come back like that. So that is called perimenopause. Peri means around the menopause. Okay. Then eventually the period stops. Permanently, and we say period has stopped permanently if the woman does not get her period for 1 full year. Yes, then it stops. So nature is very good. Thank you so much, doctor. Yes. What could be the leading cause of menopause? Yeah, real menopause is design of nature, and it is a normal event. It is supposed to come normally. The only challenge with menopause is there is this variation where it comes earlier than expected. Oh, then it's abnormal. In some women. In some women, yes.
Because sometimes you see a woman is 47 and she's still giving birth. And this one of 45
yes.
cannot.
Yes. There are some women, for example, if somebody's period stopped before 40 years, then that is said to be premature.
Oh.
But there are some I've seen also whose period stopped by 25.
Really?
Yes, and that happens.
What is the normal age that the periods can always stop at?
Yeah, it should be a transition between 45 to about 55.
To about 55.
Yes.
Okay. Thank you, so, Doctor. There are some signs that women can look out for to detect menopause on the way.
Yes, so menopause actually it comes with the specific drastic symptoms.
Okay.
And I think, but it's variable from one person to another, but they are common ones. One of them is, of course, changes in her periods. Okay. So when she's in the perimenopausal period, the beginning stages of the menopause, the periods start being irregular. Okay. She can miss sometimes. Sometimes they can be for fewer days. Sometimes they can come more than once in a month.
That is now around 40 years.
Around 40 years, okay. 40, 45 years. Okay. So she goes with that irregularity for about 5 years.
By that time, can a woman conceive?
Yes, yes.
Okay.
Yes,
okay.
she can actually conceive.
Okay.
But miscarriage rates are very high in that season. Yeah, so changes in her periods is the key. And eventually the period stops. Then she goes into full menopause. Yeah, but then, as we said, the ovary also has a function of producing hormones. Now, as the ovary function goes down, the hormones are down, and especially estrogen. When the hormones go down, they bring in symptoms which can be very disturbing, and one of the commonest is hot flashes. So the lady is there during the day, and all of a sudden she feels heated up.
Where is the heat?
It's the body changes. So this
you feel the entire body or from the internal?
The entire body is in heat, but you feel it more in the upper part. Yeah, so you find she feels hot all of a sudden, and sometimes she can even sweat, especially in the night. She can sweat a lot. The bed is drenched up. Yes, so sudden hot flashes. That's one of them. But also it affects the entire body actually. Yes, it can show up as changes in concentration, mentation. You know, this is a lady who was very sharp, interested in many things. You find now she starts slowing down with her thinking. She can become very irritable. Different
parts of the body
will be affected.
Getting affected. Yes. Do you have an illustration here so that we can see?
Oh yeah, I picked up a diagram of the symptoms of menopause. Maybe we can have that displayed. Yes, right here. So this is a typical array of a few of the presentations. There are many more actually, yes. So as I said earlier, it can be right up from the brain, from the thinking. She can slow down in her thinking.
Memory loss.
Memory loss is one of the things, yes. So she starts maybe even fogging of, you know, she's not able to comprehend. This is somebody who was very sharp and if you are reading her scripts, you will notice. You know, that, but this is a bit strange. Does she have problems at home or whatever? You
call them, you discuss something, by the time you're calling back, they don't remember.
Yes, they don't remember. And then the people who are affected the most actually are the immediate people, because they are used to these ladies going out, their husbands. Sometimes this is the time when the man starts going out, you see, because he cannot understand. He's like, and the lady is very irritable. She really changes. So she becomes irritable. She's complaining a lot, you know. She's sweating now at night. This is a lady who used to be, you know, okay, who come close to the husband is now sweating too much. Her periods, of course, become irregular. She loses sexual drive, you know, and sex becomes difficult because she feels dry.
I think that's the time where women tend to walk out.
Yes,
physically.
They sometimes walk out if it is not much that is attaching them to their partners. And especially if the partners are not understanding, you know, this is the time when you have to redefine the value of your partner. She's more than what pleasure ever she had been giving to you. And these are more during the perimenopausal times. Then when the perimenopausal period is over, actually the body adapts. She can actually start feeling better.
Oh, normalizes.
Yes, it normalizes. Her mentation becomes better. But of course, she will not look younger anymore. Yes. And if she's serious with her body, she can reshape herself back.
Okay, okay.
Yes.
Irregular periods,
yes.
Dryness. Yes. Let's talk about this bladder thing.
Yes.
I was talking to someone some few days ago, and she was like, she needs to go and test for diabetes.
Yes.
Diabetes.
Diabetes, yes.
She pees a lot.
A lot, yeah.
And I was wondering, so when you talk about this, it could be related to, that. And
yes.
she's in 45, 46 around there.
Exactly. So she needs to be checked up. It could be that. And
she actually went for a checkup, but she said there was no UTI, there was no malaria, no diabetes.
It may be
I think it could be that.
It could be this. Most likely it is this. So she needs to... One of the ways of managing the perimenopausal symptoms is awareness.
We'll create awareness so that the woman is aware, and the husband especially,
exactly.
Around.
Yes.
Okay.
Yeah. If you are aware that you are going through this season, then you know it is natural, you can adopt. You know, you read more about it, and then you will manage very well.
Thank you, doctor. Let's talk about shortness of breath.
Yes. What
happens here?
Yeah, again, it is the effect of the hormones. So our breathing, most of our breathing is under spontaneous control. We don't decide when to breathe and how fast, but we have some bit of control. Now, this nerve, the nervous system that controls the breathing, is influenced by the levels of the hormones. Yes. So so there's that so those two nerve balances, they get disorganized by the hormone imbalance.
When does this happen? Could it be when you're working, when you're sleeping, when you...
Anytime, but the triggers are usually stress. Yeah, so it's stress. You find sometimes she's there, she starts getting shortness of breath, she can tell you she's running out of breath, you know, and
you think it is pressure.
Yeah, it's pressure, or you think maybe people are not understanding, you know. Yeah, so those are the issues.
So how can women avoid all these causes and difficulties that they can...
So one of the key things in management of menopause, actually what is most disturbing is the transition time. Somebody has been used to the normal schedules and the normal feelings and the normal thinking, you know, but all of a sudden you are going through a process. And so this becomes very challenging because sometimes you lose what has been there to you. Some of the work you've been doing, you will not be measuring to it. You know, your performance in every aspect of life may go down. So, but one thing is you need to accept it's a natural process. But you can get through this season much more easily if you pay attention to certain things. For example, it's good to have regular exercises.
Okay, okay.
If you are getting through the perimenopausal period, exercises are very, very key. They help to stabilize the nerve functions. They do help to stabilize the nerve functions.
Okay.
But also you have to take a lot of water because the dryness you feel can get better with a lot of water taking. So you take water. But also another advantage of taking a lot of water is it helps you to manage your weight. Around the time of menopause, perimenopausal time, because of the several changes, people get withdrawn. They can resort to eating too much or not doing activities, and so it causes them to gain weight. So if you manage your diet very well and you take a lot of water, you will probably have a healthy weight range.
Okay.
Yeah.
Okay.
So you need to do that. And then you watch what you eat. Because what is happening, your estrogens are going down.
Down?
Yes, so you need to get foods which have the estrogens.
Thank you.
Yeah.
Let's look at the foods, doctor, before we go away from that.
Yeah.
What are some of the foods that a woman can eat?
When they are getting into menopause?
Yes, when they're getting to menopause, to boost their immunity up.
Yeah. So there are about 3 things which we are looking for in this food. One is we would like to have food which can help the woman have top up her estrogen level, for example. Yes. Now, these foods which have estrogen in the natural foods are things like sim has that. Beans do have some some estrogen. Some nuts have estrogens. We call them phytoestrogens. They are plant estrogens, and so they can help. Yes. But also other foods we would want to pay attention to are those which have calcium. Because one of the challenges with drop in estrogen is the body's ability to maintain strong bones. Because it is the estrogen which helps the body to absorb, the bones to absorb calcium. Okay. Yes, and so you need a lot of calcium, because with low levels of estrogen, the calcium absorption drops down. And so you need more calcium supply. Yes. So with that, if you have an additional supply of calcium, that's good. So that's why we encourage people to take things like the milk products. Yeah, the milk products are very good in that. Things like yogurt, they have that. Then the third thing is vitamin D. So I want to mention these because these are things you can do on your own. For example, for vitamin D, it helps also with the strength of the bones, but also it helps with immunity as well. What food can someone eat to get vitamin D? Yes, so vitamin D is in oils. Yes, it is cooking oil. Cooking oil also has some, but also especially this fish oil, and also fish is a good source of vitamin E. I mean vitamin D. Vitamin D. Yes, and also we do get vitamin D naturally. We can make it in the body when we're exposed to sun. So we encourage these women to have adequate exposure to the sun. Okay. So in the morning you expose yourself to sun. Basically you need to understand your physiology. Okay. Yes. Thank you, doctor. How can men be helped to deal with menopause? The men? Yeah, so incidentally, most of the men really don't get to understand this early now. They are caught unawares because they don't know. So getting them to know is very important. And also the woman should get courage enough to explain to the man that, you know what, this is what's going on with me. I'm seeing irregular periods. And I usually encourage that when the woman is going for checkup related to this, she should go with the woman, with the man. With the man. Yes, because the man can get that information from the doctor. And that is very, very key. So men have to be made aware that this is happening. It really breaks down the ladies. It raises a lot of questions in their minds. It can lower their esteem. A lady who has been working on herself all the years, like, now I am finished. Yeah, I am done. The eggs are not there. Now hormones are down. So now this guy maybe is not interested in me. And you know, the caring hormone of the estrogen, it goes down, and the lady's care for the man can actually go down. And the man has to understand. The man has to understand that the time has come. The time has come, and it may be in a transition, but with good care, she can pick up again. She can regain back from there. Yes, please. Doctor, you talked about estrogen levels. I don't know if you can go into details. Yeah, so this is just to illustrate the levels of the estrogen. Initially, we start much lower, but around 20 years, it's a bit up. Goes up until you reach a peak around 30, 35 years. Yes. Of course, by 40, you start dropping going back. Until eventually around 50, around 60, it is really low. Yes, not enough to sustain you. Then the period disappears. Okay. And it goes low and low. Yeah, so this is just really the simple illustration for that. Thank you so much, doctor. There are some common health problems that mothers or women can really get and face when they're in menopause. Yes. So apart from these which we have talked about, the psychological problems, one of the things I want to emphasize is this is the season when, if it's not well managed, she can actually break her bones. Oh. Yeah, she can break her bones. Yes, she can break her bones because the estrogen is low and the calcium store in the bones goes down. So this is a prone time. If the lady is an active athlete, well, this is the time when she should be doing exercise for her health only. It's not the time to do competitive athletics or competitive basketball or something. Yes. So there's a high risk of but also
breaking your bones.
Yes, and we also know that there are some illnesses like heart issues which show up around menopause. Yeah, this is the time when the women start getting heart problems around that time.
Okay.
Yes.
Okay.
So all those things, when a woman gets into menopause, that's the time when she needs to visit the gynecologist a bit more regularly. Some cancers now show up that time.
Really?
Yeah, because the body's immunity is down, and the immunity was needed to clear any changes in the cells. Now it's down, and anything can happen, or anything which was already happening before can flare up.
Can come up.
Yes, can flare up.
Are there some ways that it can be controlled, treated, or to avoid those arising health problems?
Yeah, the most important thing is really the regular checkup. You need to visit your gynecologist so that he keeps a watch over you, but adhere to the advice. You need to adhere to the advice of regular exercise, feeding very well, and maintain good state of the mind. Read to stimulate your mind. Yeah, you can regenerate the functioning of the brain, and you can overcome the clouding of your thinking. And involve in social activities. Don't isolate yourself. Join women's groups. Join women's groups. Join the social clubs. Yes, join the choir. Join the choir and sing.
And you distract the menopause.
Yes, the menopause, you put it aside.
You put it aside.
Yeah,
you shouldn't wait for it to control your entire body.
Yes.
Wow, that is powerful.
Yes.
That is very nice. Yeah. It's still Medical Minds, and we're looking at menopause. We want to understand deeper, and Doctor is trying to explain to us how we can fight it, we can manage it, we can deal away with it, just in case you're experiencing it. The moment you reach around 40 to 41 onwards, just know that is the time. That is the cycle of life. We cannot run away from it, but there is a way we can always handle it. And to the men watching, that is the time that you need to understand that a mother or a woman or a wife is going through another transition in life, that they need a lot of your support. Because in most cases, you don't know. Before you know it, you're criticizing, moving out, and you end up losing the family. So we're getting back to Doctor, and he will tell us how best women can prepare their minds to handle menopause. Yes. Doctor, someone is already 40 years. Yes, how can they start preparing? You know, sometimes you get scared. Just like when you go to the hospital and the doctor tells you, know what, you are sick. I think you live in the world for only 5 days. Oh God, you start imagining a coffin, you start imagining a lot of things. So now here is menopause approaching on the door. Yes, how can mothers prepare their minds, prepare themselves to get it positively and move on with it? Yes,
so there are some simple things you can do.
Okay.
Yes, you can do. But one of the key things is to be aware that this is coming.
Okay.
I would encourage every woman who is like 35 and above to start accessing some literature about menopause, to read. It prepares your mind. It's good to know this early, because there are certain things which you can do which will ease the symptoms, but also which can postpone the menopause a little, can push it a little bit ahead.
A little bit ahead.
Yes, a little bit ahead. Like these simple measures, like those of the diet I've talked about. If you start taking these foods which have the phytoestrogens a little bit earlier, before you really get into the menopause symptoms, you realize your body gets used to it. By the time you go into menopause, you're actually able to manage bigger amounts.
At times you might not even realize it.
You may not realize, you may slide in smoothly.
True.
Yes,
true,
so it's very important. Things like exercise, because you cannot wait to start getting menopause symptoms and then you start doing exercise. It will be very strange to you. Your body may find it very hard to adopt to.
And if you don't achieve, you get a lot of mood swings.
You get mood swings, you get frustrated, your muscles will be paining both from the exercise and from the menopause, and then you have a lot of demand, and you're like, you know, so you become moody and you lose your friends. Sometimes it can be so close friends who really, you know, this is not the person we need.
She has changed.
Yes.
She's rude, she's no longer friendly, especially in-laws.
Yeah, especially the in-laws, yeah. So when they come around, they're like, this lady is changing, you know. Yeah, so awareness is quite key, so that you're able to know what to do. So what to do is the right diet. You need to feed, you need to do regular exercise and you start early. But there are also some diets you need to avoid. Now, important to mention here is coffee. We grow a lot of coffee, but coffee is not a very good thing for the transition time.
Especially for women.
Yes, because you know, the other challenge with the coffee is you have initially been a very busy person. And as you're busy in most offices, they have coffee machines. You are depending on coffee. I'm going for a meeting. I want to, espresso, what? You're on coffee. Now, you get addicted to coffee actually. But now when you go into menopause, you must tone down and actually stop coffee.
Okay.
Yeah. Coffee makes the symptoms worse. Coffee makes the symptoms worse. Another thing which makes the symptoms worse is alcohol.
Okay.
You must avoid alcohol because alcohol destabilizes the nervous system.
How about wine?
Yes. It all has alcohol.
It's all the same.
It has alcohol. So it makes the symptoms worse. Apart from the fact that also it brings in, it increases the risk of the health problems, the heart problems you're going to get, the vessel problems you are likely to get. So it's, and then finally is this thing of the spices. Spices do make the symptoms worse. So those are some of the things you need to avoid.
Spices like the one we use for frying?
Yes, the ordinary spice in your food. It makes the symptoms worse.
Doctor, turmeric is a spice.
It's a spice.
Most cases, health workers advise us to eat turmeric, the local kanzali.
Yeah, but as long as it is spicy and you're getting into menopause, you need to tone it down because it has negative vascular effects. It makes the hot flashes worse, the excessive night sweats. Now, what makes it worse is you also have, the woman has changes in her taste. And when we have bad taste of food, we always go for spices.
True.
Yeah, true, we are going for the wrong things. You know, it's very complex, but awareness about it is very key.
Okay, okay.
Yeah.
Thank you so much. It's still Medical Minds. We're looking at basics and understanding menopause with Dr. Anna. But we're going to have a very short break, and when we return, our lines will be open. You'll be able to send in your messages, calls, audios, or whatever question that you want Doctor to get to you, and he'll get back to you. Stay with us. Welcome back from that break. Meanwhile, we are still talking about menopause. Keep watching Bethany TV so that you don't miss out on Bethany Mwalimu, where you can win many prizes for yourself, especially learners who are soon going back to school. You can win sanitary pads in case you're a girl. You can win a ream of papers, bags, pens, very nice, interesting scholastics and of good quality. It's still Medical Minds. Welcome back. Our lines are going to be open. Please keep on sending your messages on WhatsApp or audios, and then when the right time comes, you'll call. The numbers are running through the screen. Please feel free to call us when that time comes. Doctor, I'm still going back to hot flash, that hot flashes. How can a mother manage hot flash, that hot flash? Yeah, so
hot flash, basically, how it comes about is what we should talk about.
Did you say it affects the mother experiences it in the upper part of the body mostly?
Yes, she feels it in the upper part of the body, but it is actually something which is happening in the entire body.
Okay.
So what is happening is that because of the low levels of the estrogen, the blood vessels in the skin, all of a sudden they dilate. As that means they become wider, and the blood, a lot of blood is pumped to the skin, you know, just like what would happen if it is hot, really hot, and maybe your body wants to reduce the heat. Yes. So because of that, the skin feels heated up. Yes. So that's what happens. Now, it is originating from the low levels of the hormones. Yes. Now, and it is also partly affecting the effect is through the nervous system. So one of the things you can do to reduce the frequency of the hot flashes, or at least to reduce its severity, is actually doing the exercises. Exercise is very, very key in reducing hot flashes. Yes. Okay. But also being in a good state of mind, because the nervous system is very unstable. If you are happy and your mental state is good, you're likely to have less hot flashes.
Okay.
And your weight, you have to manage your weight very well.
Okay.
But in case it's not possible to have the symptoms reduced of hot flashes, you can come for hormone replacement.
Oh.
Yes. But of course, eating like the nuts will also help. Beans
would be more helpful as well.
But there are also hormone replacement medications to help you transition through. Yeah. So we give hormones from outside, so you can take them, estrogen, and they work in the meantime as your body adjusts. Okay. Yes.
How about if you've talked about the food? Is it the same as the home remedies someone can use? Someone who is in the rural setting? Yeah. What home remedies can they use basically apart from the beans? Is there any other particular things they can use?
There are a lot of supplements available on the market, but for the rural setting, likely most of the foods we have actually a lot of these estrogens, which the woman can take. She can be intentional. She can be intentional in making sure she takes nuts. Yeah, she can take beans. It's fine, especially those brown and the black beans. They are very good source of the phytoestrogens. Okay. Yes. Okay. Yeah. So these are available, really. Yes.
Thank you, Doctor. Let me ask you something about women who delay so much to give birth.
Yes.
For example, they start giving birth at 35, 30 something.
Yes.
Are they not so prone to early menopause, really?
No, not really, because menopause is, the natural menopause is a naturally programmed process. It's a naturally programmed process, and it is supposed to be, the body sets it to come at a certain time. And so whether you are giving you're giving birth early or late, it does not change when you get into menopause. Okay. Yeah, except that if you delay to give birth, you could come very close to menopause, and then it poses you problems, because when menopause comes in, giving birth is not easy.
Okay, thank you. We look at a woman who is 45.
Yes.
And she has been facing infertility challenges.
Yes.
Then all of a sudden she stops her periods. And that means automatically she has crossed the line.
Yes.
She's now on the other side. And this is a young lady, she looks young. You know, the more you give birth, also the more your body changes.
Yeah, ages up.
Yes. Is there any way, really, that this woman can be helped? Perhaps maybe to conceive, yes, and or have a child?
Yeah. So in that transition time especially, if she presents herself to a health unit, especially to a specialized place, she can be helped to get pregnant by giving some medicines to increase her chance of getting an egg. She will ovulate, and when she gets pregnant, her hormones she can get hormone support of the pregnancy from outside. Yes. But the other challenge is sometimes these pregnancies are associated with problems of genes, chromosomes, and that's how the miscarriages come about. Okay. Yeah, but in that season also, if she maintains a good healthy diet, she's likely to do better than somebody who just neglects themselves.
Okay. Yeah. Okay. Thank you so much. We're still talking about menopause. I think our lines are now due. You can give us a call or send your messages as far as menopause is concerned, so that doctor get back to you immediately before the program ends. Doctor, as we wait for callers in, we had a few questions that you didn't answer last week, and we promised the viewers that you are going to give them a little recap. There is a gentleman who sent a message last week, and he was inquiring how best he can be helped, because he masturbated a lot. For now he's married, but the wife has failed to conceive. He feels the urge to have intercourse, but every time he tries, the energy levels drop down. Yes, he's really watching, and yes.
Yes, so we are beginning to see that masturbation is one.
It was Jimmy? Yes, Jimmy.
Yes. Yeah, masturbation, especially if it's done for a long time and you start doing it early, actually can affect your sexual life. the man's sexual life. Yes. So he needs to see a sex counselor, and he can be retrained. Yes, he can be intentionally retrained to get back to normal sexual function. But it might take a lot of time. Yes, but I think in the country we have some sex counselors now. They can train you, because it is more of the brain now. The brain is tuned to sexual satisfaction through the process of masturbation, which is different from the natural. Yes, so he has to be retrained. Yeah.
We have a call online. Yes, I think he has gone. We also had Anna. I think she sent in a message from Zana. Anna is saying she gave birth to her first child, but I think due to severe UTIs, she has failed to conceive. We also promised to answer her back. We have a call online. Bethan TV, hello. Hello, good evening to you. How are you? Who is calling? This is? Robina. Yes, Robina, where are you calling from? Buloba. Yes, please, Robina, go on. Wanji? It's okay, Robina. Buuza mu Luganda, omusawo ajja kutegeera. Ye mama. Nokola ki? No bleeding nnyo. Yes, Robina. Okay. Kale Robina, omusawo agenda kwanukula. She's saying she used to bleed a lot, or she bleeds a lot.
Yes.
She got treatment, but after sometimes again the bleeding continued, and it's very heavy. And when she went for further medical, after some guidance from the hospital, she was told that she has a lot of hormonal imbalances, I think, and changes. We have another caller. Caller, hello. Medical Minds, hello.
Good evening.
Good evening to you. How are you?
Good evening.
Hello, good evening to you. How are you?
I'm all right.
Yes, who is calling?
My name is calling Tombe.
Tombe?
Tombe.
Please go on with your question.
Tombe.
Pombe.
What causes diabetes?
Tombe, you're so close to your TV set. Can you first turn it down? What causes?
Diabetes.
Pombe, we can't hear you well. You're so close to your television set. We didn't get that question. Maybe you can respond to Robina. Yes.
So Robina is talking about her getting a bleeding problem. This is her periods.
Yes, the bleeding is too
heavy.
much. Yes, heavy.
Yes. Yes, so Robina, thanks for that question. And I think a number of ladies get that sort of problem. Now, first of all, when you get a bleeding problem, the issue has to be identified. What is causing it? Usually it's an interplay between your hormones and the womb. This is the commonest. So either the hormones are out of range or the womb is not responding well to them. But sometimes there are some diseases of the womb, like the cervix. It may cause those bleedings. Or it can be things like fibroids. So see, and the management depends on what is causing that. So she said this at some point she went to Mulago. I hope they explained to her what the exact cause was.
They were telling her hormonal changes.
But it has to be specific. We have to be specific what hormone changes. what is the problem with the hormone? Is it a problem of estrogen? Is it a problem of progesterone? What is it? Is it from the brain? Is it something in the womb? It has to be clear so that she knows this is what I'm suffering from, and these are the solutions, and I opt for this. Yes.
Okay. Thank you so much. I think, Robina, you've got the feedback from Doctor. We have another caller. Can you kindly put off your TV caller? Sorry, just in case you're calling, please make sure you turn the volume of your television very low. Yes. Caller, hello?
Hello, madam. How are you?
I'm fine, thank you. How are you? Doctor, ajaduulira jakwanukula, yes. Okay, gwani mama? Bakuyita Sophie? Prosi Nalubega. Kale.
Kati ndya n'ebbumba.
Olya nnyo ebbumba, okay?
Ebbumba nga walubuto. Mbeera njo yayambanga ayina ebbumba naye bankebera. Ne bangamba nti oba nami-fibroid.
Okay.
Ye, naye kati izo n'ennaku zange eza period zali byusinga nenamalamu ennaku nnya ne kati ngendamu ennaku bbiri n'evaamu.
Bambe.
Is it a sign of menopause oba nedda?
Kale,
ekirala nfuna nnyo much pain nga ngenda mu period before.
Okay.
So nfuna pain a week number nga tinabagenda.
Kale, Prosi. Tweyanziza nnyo Kale, webale kuweereza ebibuuzo byo. This is Prosi. She's saying she's 38 years old.
Oh, she's 38.
Yes, and she eats a lot of clay, bumba, something like that. This clay that pregnant mothers eat.
Yes.
Yes, and she's not pregnant. But when she went for a test, she was checked and I think told she could be developing fibroids. Then the other thing is her menstruation period days reduced from 4 to 2 days. Yes, and then lastly, she's saying she gets a lot of pain before her periods. That's about almost a week or 5-6 days before she gets the periods. Yes. We have another caller before you respond to Prosi. Caller, hello?
Hello?
Yes, Medical Minds.
My name is Miriam, calling from Sudan.
Yes, Miriam.
I want to ask the doctor.
Please.
I have spent now 6 years in the menopause, but sometimes I find some blood that was mine on treatment, and I open what consequences.
Okay.
And I also common take tamarind of my tea, and they say that you need to use spices. Is it okay for me to take it or I have to stop it?
Thank you so much, Miriam, for your call and inquiries.
Thank you.
Okay. She's saying she's, if I had well, 60 years old.
60?
60, I think, yes.
Yes.
Unless I didn't hear, but she's saying she has been in menopause and managing it well.
Yes.
But of late, she's seeing some blood spots, some spotting. Yes. And then the other side is she eats a lot of turmeric. She heard you saying we should avoid spices.
Yes.
Can she continue eating it, or she drops it? Could it be the one maybe causing this blood spotting? Or yes. Let's start with Prosi, and then we go to Miriam.
Yes.
Prosi's question was about eating the clay, and then irregular periods from 4 days to 2 days, and then pains before her periods.
Oh yeah. So if I remember very well, Prosi said she's 38 years.
Yes, she's 38 years old.
Yeah, and 38 years is close. Sometimes these things start early, but eating clay is not one of the things we commonly see with people who are getting into menopause.
Okay.
But if they say that she has fibroids, it's possible that maybe initially she was losing a lot of blood, and now it is causing low levels of iron, and low levels of iron or high demand for iron causes people to eat a lot of clay. In mechanisms we don't know, but it's an association that we know.
Does clay contain some iron?
So that is not really, but it looks like nature designed iron to be in clay, and so somehow we console
ourselves there.
Yes, so we crave for it. So, but people do eat clay, and yet there is no iron in enough iron in clay.
Okay.
Yeah.
Thank you.
So she needs to be evaluated for her levels of blood. Yes, and the menopause does not usually cause painful periods.
Okay.
The periods may be scanty and irregular.
She's saying pain before 1 week.
1 week before.
Towards the
premenstrual period. I mean pain. Now that needs to be evaluated. Things which cause that, if she has been having them for some time, it could be other problems like infections, or it could be things like endometriosis. So that needs to be evaluated in its own way. So she needs a complete assessment to see where her exact problem is. But with that of eating clay, it could be that there is an associated low level of iron
in the body.
Because of maybe excessive bleeding she had some time before. Now she has deficiency.
Yeah.
But also low levels of iron can come from eating badly. You know, there are ladies now, especially who want to keep their weight or keep low weight. They get advice from non-nutritionists, and they go on diet, which is what I call a killer diet. I've seen somebody taking vinegar. Yes, really? They drink vinegar, you know. People are about to take jik because they want to reduce weight. Yeah, so sometimes that is bad diet management causing you malnutrition, like low iron levels, low vitamin B levels, B12 levels. So we have to be careful about how we eat. You better get an advice from a professional nutritionist.
Thank you so much, Prosi. I think you've been so attentive. Doctor has given you your feedback. We have another caller, Doctor, before we go to Miriam. Caller, hello. Bethan TV, good evening.
I think there's an echo.
Can you lower down the volume of your TV? Hello, yes, good evening. How are you? There is a lot of noise in your background. Can you please lower down the volume of your TV set?
Hello?
Hello, please. Go on.
Yes, this is Barbara.
Barbara, where are you calling from?
I'm calling from Nigeria.
Yes, please, Barbara.
I always get a lot of miscarriage. I don't know why.
You get a lot of miscarriages?
Yes, please.
How many have you so far got?
Like 3 now.
And you've never ruled out the cause?
I tried to go to the hospital, but they don't tell me.
Okay. Sorry. Have you ever suffered from any illness, like severe infections?
Yes, and I treated it.
How long was that?
It's now because the first miscarriage was like, it has taken like 3 years.
Okay.
And another one.
And how old is it?
2.
Okay.
And even of recent, I've just got 1.
Oh, sorry, dear. So sorry about that, Barbara. Let's get the feedback from doctor. Thanks so much for calling. Thank you. Barbara, 3 miscarriages. And she's saying she treated, I think, infections, those, I don't know what type of infection it was. Yeah, so she's kind of confused. I don't know how best you can advise her.
Yeah, so we start with Barbara, or there's somebody up?
Miriam, the 60-year-old. Yes, with blood spot and the turmeric spice. Yes.
So maybe we can first address so that we don't forget that.
Oh, yeah,
we'll address Barbara's. Yeah, Miriam, that's a very good question. Now, for the turmeric, when I talked about avoiding spices, I mean, the spices, the problem is they make the symptoms of the perimenopausal symptoms look bad. You know, these hot flashes, They are worse when you are just getting into the menopause.
Into it.
Yes.
Oh, okay.
And so if you are taking those spices around that time for purposes of maybe not having good taste, you can make the symptoms worse.
It's like boosting it up.
Yes. But if you are out of these, after that, you actually can go into proper menopause, where you are no longer getting those bad heart. It's okay to go back to your...
Okay,
yes.
Thank you.
Yeah, so
thank you so much.
She doesn't have to drop it as long as she's taking it. It actually becomes healthy after that.
Okay, thank you. And then we go to Barbara with 3 miscarriages.
Yeah, about the miscarriages, yes. So getting more than 2 miscarriages is referred medically to as a recurrent miscarriage. It is it's a concern, because if you get 2 or more miscarriages, chance of getting another one is very high. And in most cases, if you are investigated properly, there is usually a cause. The cause can be something in the womb, or something to do with the hormones, or it can be something to do with the embryos or the babies themselves. They get abnormalities, because some of these abnormalities are related to chromosomes and genes, and they need to be investigated. Sometimes the problem is in the blood system of the woman. Okay. So it needs more than 2 miscarriages need to be investigated thoroughly, and some of these causes can be addressed. Yeah, so that she does not have to get another miscarriage. So she really needs the cause to be identified.
Thank you so much, Doctor. Barbara, kindly take time and seek medical help. Take a proper examination and find out what could be leading to all those 3 miscarriages. We wish you well, Barbara. Doctor, you have a lot of messages here. Good evening, Doctor. I called you yesterday, but you didn't pick up. Sorry. I'm over bleeding. I was on family planning. I have removed. I don't know what kind of family planning it was. What can I do, please? I got this number from Bethan. She's saying she has been on family planning and she's over bleeding.
Oh, yeah. So if she's, as you have said, we don't know what family planning she was on. But if she was on a family planning, for example, the coil, or maybe she was using the implants.
The coil is the IU?
Yeah, the IUD. Okay. Yes, or she's been using IUD, or she's been using the implant. Sometimes when they are removed, you can have some bleeding. Oh. Yes. So if she's doing that, she definitely needs some help. There are some medications, of course. It's not right to make prescriptions on phone and TV. So, but she. Well, if she called me and maybe I was not able to pick, she can come over. I work on Monday, Tuesday, and the Saturdays. Okay. If she's bleeding, she doesn't have...
Monday, Tuesday, Saturdays.
Yes, and if she's bleeding, she doesn't have to wait for my...
return call?
Yes, return call or the appointments. She can come over to the hospital. If my line is too much, we have many other gynecologists. Yes, there are many gynecologists. Usually like 3 or 4 people are on duty every day. Okay. So if she's bleeding, that's an emergency. She must come over.
Thank you so much. Yes. I think she has got you. Hello, doctor. I had C-section surgery, but after some times I began bleeding, and doctor said it's hormone imbalance. It was stillbirth. I was given tranexamic acid, but whenever I use a taxi or border bleeding starts. I'm confused. What medication can I take? She has no name though.
If she got a stillbirth, well, it depends on how long ago the stillbirth was. If it's a bit recent, this is something which needs attention to be paid to, because the thing which caused stillbirth may still be there disturbing her. Yeah, so there could be sometimes fibroids, or there could have been infections. So considering these 2 events, if they are very close, the stillbirth and the bleeding, they are very close. Okay. I think tranexamic acid alone might not be enough. She needs to have the cause really understood. Okay. Because it can progress to other complications.
Thank you.
Definitely.
Doctor, we have a lot of messages, but I'm going to note them down. Perhaps we start with them next week, because we're really running out of time. We are into our last segment. Just in case we didn't read your message, please don't take it on. Next week, doctor is going to start with these messages, and he will get back to you immediately. Our last segment, doctor, truth or false, before we close up. Number one, women who delay to start giving birth, especially in their late 40s, are prone to early menopause. True or false?
False.
Thank you so much. Loss of hair, short memory, and sudden mood swing is an early sign of menopause approaching. True or false?
True.
Thank you so much. Heavy body exercises like weightlifting, gym, and women who are active in track fields like athletics are likely to get their menopause early. Truth or false, doctor?
False.
False. Thank you. Chronic infections like STDs and cervical surgery can lead to early menopause. Truth or false?
False.
12. Very good. Only 1 out of 4. That has brought us to the end of the show. This has been Medical Mind, and we're looking at basics of understanding menopause together with Dr. Anda. But next Sunday, please don't miss. We are going to bring you more interesting health topics, and we shall discuss more. Just in case we didn't read your message, next week we shall start from here. Doctor, your last message before we sign out?
Yes, my last message is really especially to the men and those people who are close to these women. They need to know that these women need a lot of support when they're getting through the menopause.
Okay.
It's a normal transition, and if they are supported very well, they can actually adapt very well.
Thank you.
And they're facing real problem. They need support.
Thank you. Thank you so much. From me and the team behind the gallery, thank you so much.